Hello, everybody. This is Bia Labate, Chief Editor at Chacruna.net. I am in the Reform Conference, the conference by the Drug Policy Alliance here in Atlanta, Georgia, and I'm here with Julie Holland, a dear friend and colleague. And Julie is an MD and psychiatrist and has edited two important books, one about cannabis and one about MDMA. And she has played an important role in advancing different research in the area of psychedelics. And she's an author, and she's a woman, and she's outspoken, and she's a kind of, reference for me. And she has been very supportive of me throughout the years. So it's really pleasant to be here with her. And I just would start by asking, are you participating in any panel? Why are you here?
It's also pleasant for me to be speaking with you, Via. I'm here speaking on a panel called Psychedelics 101. And it's basically sort of the intersection of psychedelics and harm reduction, and trying to figure out if there's a place for psychedelic-assisted psychotherapy in the harm reduction movement, and also talking about sort of a drug policy reform around psychedelics.
Is there a place for psychedelics in the harm reduction movement?
I'm glad you asked. I think there is. So I've been a harm reductionist since before I knew what harm reduction was, and like the early 90s, and participating in needle exchange programs and things like that. And I am a harm reduction psychiatrist. But I've also been really interested in psychedelic research and psychedelic psychotherapy for a very long time. And so it turns out now that my two main areas of interest are intersecting, which I love. So this idea that you can have psychedelic assisted psychotherapy or just a psychedelic experience, never mind the psychotherapy, but that may have an effect on your drug-taking behavior. So, for instance, in my private practice in psychiatry in New York City, I have patients who used to take a lot of opiate pain medicines, but since they've discovered cannabis, they don't. Or I've had patients who, because of an ayahuasca experience or because of ibogaine, they're no longer using opiates. So I think there's research going on with using psilocybin-assisted psychotherapy for alcoholism. There's a lot of research in the past about using LSD to treat alcoholism. So it's this idea that you can actually use one substance to change your relationship with another substance. That's really interesting to me.
Yeah, it seems to us that are involved in this movement that it's a pretty basic idea, but actually in terms of drug policy, this is kind of considered a kind of outrageous idea, or, you're giving a person a drug and you want him to get off that drug, but you're going to give another drug instead. So, right. There's lots of backwards behavior. I was wondering, do you have any, either personal story or story from your patients to tell on how you have witnessed this process of transformation by people treating some kind of drug problem abuse by using psychedelics or cannabis? Can you tell us a little tale? Do you have any experience that you could quote?
Well, I don't necessarily want to give away patient stories, but I have a friend and colleague who isn't a patient, Jason Pinsky, who had a car accident and was completely addicted to very high dose opiates and was able to use cannabis to completely get off opiates. And there are plenty of stories like that of patients who are using cannabis-based medicines so that they don't have to take their opiate-based medicines. This crazy idea that you can use a drug to get off other drugs. There's a saying in chemistry, like dissolves like. You need a polar solvent to dissolve polar bonds, and you need a non-polar solvent to dissolve non-polar bonds. So this idea that you can use something to get off something else, from a chemical point of view, it totally makes sense to me. It's not so crazy. But the idea with MDMA assisted psychotherapy, or with taking ayahuasca or having ibogaine, is that you have this sort of intense, for lack of a better word, I will say a spiritual awakening, where you sort of have this epiphany or an aha moment, where maybe you can pull back and see the whole picture, or just sort of get the lay of the land and realize you've been going around in circles and you need to change your path, and that can lead to changes in behavior. The other thing I'm very interested in is this idea of neuroplasticity, neurogenesis, that psychedelics can actually potentially change the structure of the brain, change the wiring, change the way the connections are. Some people talk about it being like a reboot or a reset. From a psychiatric perspective, you can get a reboot or a reset with shock therapy also. I don't think it works as well. I think that psychedelics are potentially this whole other arsenal or armamentarium of sort of weapons in the fight against drug addiction. I mean, there are people who have difficult relationships with drugs, and sometimes exploring that relationship with the assistance of MDMA or psilocybin or ayahuasca, they can sort of change their relationship to drugs, and therefore they change their drug use.
And then, but coming back to like this traditional dichotomy, is it the drug, is it the substance, or is it something about the context or the relations or the connections that you're able to establish? How would you speak about that?
I mean, I would say in many instances it's both. The clearest thing I think is if you talk about ibogaine, where there really are effects of the drug that affect the opiate receptors, that sort of reset the receptors where you do not have withdrawal or tolerance, like that seems to me very much to be a drug effect. On the other hand, with ibogaine, you have a pretty intense one-day or even multi-day sort of psychedelic experience, and you have some insights, and you're thinking a lot about a life review and where your life goes, and what makes sense. And that's not the drug effects; that's more sort of the psychological effects. So I really think that it's both. The John Hopkins psilocybin research, they had really impressive results with cigarette smokers. People who'd been trying to quit for years and years, who'd been smoking for at least 20 years and couldn't quit. And in the context of ongoing psychotherapy with psilocybin, they were able to quit smoking. So it's possible that just all this therapy, you can sort of tease apart the therapy and the drug in that situation, because they had a controlled experiment. Some people had psilocybin and some people had placebo, but they all had the therapy. And the people who had psilocybin had markedly improved quit rates of smoking from the people of placebo. So again, it's got to be more than just the psychotherapy. That it is.
Yeah, I also don't think we need to know exactly what, maybe that's not even the correct question. Is it the drug or is it the context, and where does one end and where does the other one end?
Yeah.
But perhaps could you speak something on this, about this idea of connectivity, or how psychedelics can create connections that you were talking to about in the panel?
Yeah. So, well, first of all, what we see now with like fMRI studies or PET scans or things like that is that when people take psilocybin or LSD, their brain gets sort of hyper-connected, and areas of the brain that didn't used to communicate start to communicate. At least it's sort of a temporary rewiring, where things like the default mode network and how the brain usually works, everything gets kind of flipped around, and these disparate parts of the brain that aren't usually connected get connected. There's like a hyper-connectivity that happens with psychedelics. So I think that that's sort of on a macro level you can see that. But on a micro level, there's new research about ayahuasca or psilocybin in a petri dish using stem cells, showing that these psychedelics create neurogenesis, that the sort of progenitor stem cells turn into neurons, and there is enhanced connectivity, like brain cell to brain cell. So not just that different parts of the brain are connecting that weren't connected, but actual neurons are connecting that weren't connecting before. So that's very interesting to me, this idea of sort of psychedelic-assisted neuroplasticity or psychedelic-assisted neurogenesis. But that's a piece of the puzzle. That's not just about what you're thinking and what you're talking about, but there may be something really structurally happening as well.
Yeah, it's so really overwhelming to see like how many new research findings that have been coming out, especially happy to acknowledge that some of this research is coming out of Brazil. And I just wanted to, go towards a conclusion and perhaps ask you, what do you think are the main challenges that we face with psychedelic research in the U.S. and globally?
Well, I think the first challenge is probably just stigma. There's a lot of baggage with psychedelics, and there's a lot of misinformation, sort of apprehension about people taking these drugs. I think people are afraid of losing control and what that means, or they're afraid of really digging and learning. There's some dark stuff that's going to come up, and I think that a lot of us, out of sight is out of mind, and ignorance is bliss. And so I think that there's a little bit of a fear about exploring the sort of darker side and the shadow self, and getting a better sense of what's driving some of the behavior that we wish we didn't have. So I think that there's resistance and fear around that, and the stigma. I think that there is still a bit of stigma about these drugs and using these drugs, and so I think that's our biggest challenge to overcome. And then obviously there's the whole legal structure framework of how it's very difficult and challenging to do research with a Schedule 1 drug, and most of these drugs are illegal in Schedule 1, and that makes it very tricky in a institutional setting to do this kind of research.
And what about just doing some really futuristic exercise? Do you think that maybe psychedelics in the future are going to be sold and branded like cigarettes, or is there a danger of commercialization, or can you speak anything about that?
I do worry about the danger of commercialization. I saw a documentary recently about ayahuasca, and I saw that if you go down to Peru, that there are people sort of on the street trying to convince you to come with them, and they're going to sell you something. And I do worry that things are getting commercialized. I mean, we've seen this with cannabis. We know that it's a real danger. So
I'm thinking about not ayahuasca. I'm thinking about psilocybin or MDMA, right, or right, things that are from here, and that. What about that?
Yeah. I hope that doesn't happen. I'm pretty optimistic in general. Maybe I'm not realistic. I know that that's a possibility. I mean, we've seen it obviously with cigarettes and alcohol, and the way America works is we're pretty consumer oriented and materialistic, and so that may happen. But
is it psychedelics to use drugs and to psychedelics to actually make us more creative, to make more money or something like that?
Yeah, it's hard for me to get behind. I mean, I understand that people are microdosing and they're talking about sort of being more productive or being better workers, but I feel like for the most part the microdosing talk is around creativity and problem solving. But I think there is probably that risk in what you're saying.
Okay, well, we're not going to solve all the problems of humanity today, so just thanks for bearing with us, and keep on tuned, chacruna.net. Thank you.
Thank you, Bia.